Morning, everyone. This is Deb Henton, the Executive Director of MASA. We are so pleased to be able to offer to you this information session. I know that you are going to hear from some experts who have a lot of information to share with you. We're very grateful that they have come forward and are working with MASA to get some information out there about vaping and other issues, obviously, that are affecting our schools. But today, the conversation is definitely about vaping. And so I will turn it over to Emily Anderson of the Association for Non-Smokers, and she will start the presentation and introduce our speakers. So again, thank you. And if you could please turn on your cameras, if that is something that you're able to do, we would appreciate that. We know that there might be some times where you have to step away, but it's always great to see people live and in person. So happy Friday and then happy early Veterans Day to you. Emily?
Thank you so much. Good morning, everybody, and thank you, Deb, for that introduction. I will be serving as facilitator for this wonderful presentation that we have for you all today, just chock full of information about how we can work together to address the youth vaping epidemic in schools. We have three super knowledgeable, super dedicated folks talking to you today, including Elise Levine-Less, who is the Executive Director of the Tobacco Free Alliance. We have Pat McCone, Senior Director of Advocacy and Policy at the American Lung Association. And then last but not least, we'll have Marissa Katz, who is a staff attorney at the Public Health Law Center. Next slide. So in this presentation, it's really important when we talk about tobacco that we're referring specifically to manufactured commercial tobacco products and not to the sacred, medicinal, and traditional use of tobacco by American Indians and other groups. That's just to set the playing field very level. When we're talking about tobacco, we're talking commercial tobacco, cigarettes, vaping products, etc., and not sacred tobacco. Quick overview of what's to come, and then I'll turn it over to our speakers. We'll be telling you what's in an e-cigarette, what are these things, what some of the health risks associated with e-cigarettes and vaping are, youth use, the trends that we've seen over the last few years with these products and how we've seen that change and how we can address that. And then how did we get here? It's really the industry, the vaping industry that has been targeting a new generation. And then finally, again, last but not least, what schools can do about vaping. And really, this is how you can address this in the K-12 setting. So without further ado, I will turn it over to Elise to start off with the basics. What is an e-cigarette and what are these things and what do they do to our young people's health? Go ahead, Elise.
Thanks, Emily. Hello, everybody. Thanks for having us here today. So I'm starting with not knowing exactly what you know. You may have old information. You may be right up to speed based on what you see in classrooms and what you see in your schools. But we're going to just start with the basics. So what is an e-cigarette? E-cigarette is the same thing as vapes, and they are both called technically an electronic nicotine delivery system. This is something that I really like to talk about with kids because they all know what a vape is, but most often when I speak to classes, they think an e-cigarette is a different product and it's just something grown-ups use to quit smoking. And it's just all about the targeted marketing to different audiences. And that's what we talk about. Next slide, Em, thanks. So thanks. Okay, so, e-cigarettes have not been on the market very long in the US. They started out in 2007, coming to the US market, and they looked like cigarettes. Obviously something that really wouldn't be that appealing to kids. When we talk to kids about cigarettes, they know so much about harms. They think they're gross and they're disgusting and awful. And they know about all the cancers. They know about black lungs. They can tell you all the dangers of cigarettes. So I'm looking at the products when they first came out. That was just something that would not have been appealing to kids. And then about 2012, the tank mods started showing up. And those were e-cigarette devices that use freebase nicotine. Then the whole landscape changed when Juul came on the market in 2015. As you know, they started looking very different. The products were sleek and designed to feel good in your hand and look like other products. I'm wondering if anyone in the chat could talk about or could mention something about, like, do you remember the first time you saw a Juul? And what you saw, and what if you thought it was a flash drive? Like all of the teachers I talked to in about 2016, 17 were saying what is going on here? Kids who would never pick up a cigarette are using this. Well, what Juul did is it changed the type of nicotine that was used in the devices. They created something called nicotine salt e-liquid. And what that did, it was different from the free-base nicotine. It allowed the user to get this incredibly strong hit of nicotine and hold it much deeper into their lungs because it was a much smoother hit of the nicotine. And of course, it came in tons of different flavors, and it made it, of course, also then easier and actually would taste good versus a tobacco flavor. After Juul came on the market, everyone wanted to get in on the action, and there were tons of copycat pod mod devices that came on the market. And then things shifted again. 2019, big explosion of disposable vapes. That is a misnomer, and I know Marissa's going to talk about that later, the environmental harms, but because they are not disposable products, can't throw them in the garbage. And then after that, it evolved even more. The tobacco, the people thought that, oh, well, we'll change it and we'll make it nicotine. We'll make it tobacco-free nicotine, thinking they could get away from the regulations. And we're going to talk about that in a minute, but they also are regulated as tobacco products. And now we're in 2023, and I've run out of room on this slide, and I really need to redo it because the products are continually changing. We have 15,000 different flavors out there. There's more and more nicotine, and we're going to dig a little deeper into that as we go through this. I just want to mention also, whether it's so that all e-cigarettes are regulated as commercial tobacco products, and we just talked about that, and they're considered tobacco products under federal and state law, regardless of if it's a pod mod vape, a disposable vape, a tank mod, or other e-cigarette device. They are all what I described as ENDS, electronic nicotine delivery systems. And it doesn't matter if they contain free-base nicotine, nicotine salt, or nicotine derived in a lab. Okay, next slide. I want to talk a little bit more about this nicotine salt e-juice because it really did make a huge change in how it got, they're the brunt of what's, the youth vaping epidemic. Excuse me. So I think I mentioned it was developed by Juul, and it allows much higher levels and efficient delivery of nicotine. And it's used in both open systems and closed systems like Juul and the disposables. And it's pretty egregious. So the effects of being able to get that into your body so quickly. So next slide. I show you this slide because it's old. It's from 2018, and it was illustrating how much nicotine was in these products. And they were using a pack of cigarettes as a example of, there's 20 cigarettes in a pack, 20 milligrams of nicotine in the pack. And everyone was outraged when Juul came out and we started getting the information that one little pod had the equivalent nicotine of 1 to 2 packs of cigarettes. That was appalling. And then we started, as I showed you, some of the products started evolving. Now let's fast forward to the next slide. And now we're in 2023. Okay, so products that started coming out late 2021, 2022, all of the marketing was about how much more nicotine you were going to get in the product. And I just used the illustration of an Escobar, which is it's one of the top brands used by youth. Loon bars. Loon is a e-cigarette brand that's located in Minnesota, very popular with Minnesota young people. They all know what this is. And as you can see, there's differing puffs, and people ask me sometimes, so how much is the equivalency of 4,000 puffs or 2,500? It depends on how much nicotine liquid is held in the device. So the most egregious one I've seen until just very recently was the Loon juice box. This little device has the equivalent nicotine of 35 packs of cigarettes. And it's something that a kid can put in their pocket or vape and stick in their bra, which is something I hear a lot about. And it's just, again, discreet and small. How long does a person use this? That is a great question. So here's the thing. I'm going to answer Lori's question. How long does a person use the device? It really depends. It depends on how a user, how somebody vapes. When you think about it, a kid oftentimes will be like running to the bathroom to vape between classes, right? And they're getting hit after hit after hit of nicotine. And I can't tell you exactly how much a kid would be getting, or somebody would be getting, and how long it would take. Some maybe a day or two, some it might last a week. I'm actually had something about this that I wanted to add. But of course, okay, 1 second. Nope. Anyway, it's really hard to, yes, oftentimes they're shared and kids sit and share them in a circle in the bathroom. And, that's what's really concerning is that people don't realize how much they're getting. Considering a cigarette, somebody really knows if they're a pack a day or a 2-pack a day smoker. You can see it disappear. There's a beginning, middle, and an end. And the way that vapes are used, you can't tell until the red light goes off. And there's actually a whole culture around that on TikTok. We'll talk about that in a minute, about, it's called blinkers, where kids are vaping to get all the way to the end of their device so that the light will go on, and they post about it on TikTok. So there's huge youth culture around this, and it's quite disturbing. So I kind of went off on a little tangent. Sorry, because I really don't know exactly how much kids are getting when they vape one device and how long it's going to take to go through it. Next slide. Here's something that I just recently came across in the beginning of October. Loon is one of the brands I mentioned that is the Minnesota brand. Now they're advertising 7,000 puffs. Amazing, five amazing flavors. And I think I just mentioned that we now have more than 15,000 vape flavors out there, right? And so here's another ad that popped up for me. Dummy vapes. This was around Halloween that I saw this. When you think about this, these are supposedly adult products, right? They are supposedly targeting adults with these products. But as you can see, who's going to be buying this when it's got dummy vapes and pictures of, pictures of scary figures and things that kids are thinking that's interesting. So this is something we see all the time. I could show you 10 slides worth of marketing to kids with something like this. Okay, next slide, please. Now, this is something that just recently came on the market, and there's been a lot of media around this. They're called highlight vapes. And I want you to see, this is from their website on my left. Welcome to Highlight Vape. We specialize in creating innovative and discreet vaping solutions, right? It makes the perfect option for those who want to vape discreetly in public. Gee, I wonder who that's targeting, right? As I'm talking to school administrators. The thing is, with this product, we have not seen it in Minnesota. And maybe, Pat, I don't know if you have, but we have been scouring looking for it, actually. You can go on the website. You can't even order it that way. I know that they've seen, my sister's a teacher in California. She has seen these in middle schools and high schools. But when I went out to see how I could get one as a sample, I found out that I would have to buy them wholesale in China and, buy thousands of them. And that's what I've seen so far. So just wanted you to be aware of this, that this product might be coming soon to a school near you, unfortunately. Next slide, please. So I know we're talking about vaping, but I also just want to highlight other, quote, tobacco-free nicotine products popular with young people. So the second most popular tobacco product behind vapes with young people are the little oral nicotine products. These are marketed as tobacco-free. They are made with the synthetic nicotine that I mentioned, and it's made in a lab. So that's why they advertise it as tobacco-free. It's not made with leaf, and people think, oh, that's healthier. I don't know if you've seen these at school, but they look just like mints. Lucy breakers. There's little pouches that you can put in your mouth. You can. There's gummies, nicotine gummies. And they look like candy. So something for you to be aware of that's out there. And they don't have as high of amount of nicotine as a vape, but there's still nicotine in them. Okay, next slide, please. So let's just talk about the e-cigarette health risks. We all know that nicotine is harmful. And we're talking to kids, it's kind of hard to say to them, well, you could have a heart attack or it could lead to cancer. Smoking nicotine is associated with these things. They don't care about that because they're kids. They think they're invincible. They just want to try the gummy bear flavored vape. So one of the things we talk to kids about is how it impacts them now. But just for your understanding of what we know so far about the nicotine in vapes compared to cigarettes is that we know that it still has negative impacts on the product. Yeah, what's happening? Is there something I should be answering in the chat or should I wait? Okay, I'll wait. It's popping up. So one thing that came out recently was a 2022 studies that were they were preliminary research studies that showed that there was a similar finding about e-cigarettes when it came to nicotine. So we saw that there was still changes in cardiovascular function, and we saw that there was an increase of blood pressure and heart rate and flow of blood to the heart and a narrowing of the arteries. So something that we're starting to see and being able to quantify and understand, like what we have been able to do with cigarettes. All right, next slide. I have a pop quiz. Please put your answer in the chat. Which is the fastest and most addicting way to get drugs into your body? I'm going to look at my chat and see what people have to say. I'm waiting. B. Okay. C. Okay, so the answer is B. I was surprised when I saw that because I would have thought it would have been intravenous. But I recently learned at a conference, at a study that professor of psychiatry from Rutgers shared this information in a presentation that I went to public health people. I think people don't want to, yeah, that's true. That's a good point. Okay, I should stop looking at the chat. All right, nicotine in the adolescent brain. This is where we really dig in and have conversations with kids. Trying to get them to understand how this is impacting them now. You know, you're all educators. You know, adolescence is a critical period of brain development. Funny that kids all seem to know that their brain is not fully developed until they're 25. I am telling you, from 6th grade on up, they all seem to know that. But one of the things we talk with them about is trying to describe how the risk-taking pleasure part of your brain develops before the judgment part, which I joke with them is like a kind of a big design flaw, because part of being an adolescent is taking risks, and that's normal. But what do you do in the situation where you're this is happening for the first time and you're trying to navigate this? And the way we talk about it to teens is that the emotional part of their brain and the rational part of their brain is just not synced up yet. And it's really hard for adults to use good judgment with risk-taking behavior. And imagine you are all doing this, youth, teenagers, for the first time with a brain that is not quite ready to take on those risks without really thinking through the consequences. So we also know, and I think you probably know, that no amount of nicotine is safe for young people because of how highly addictive it is to their developing brain. And we know that nicotine increases the risk of smoking conventional cigarettes. And we also know that youth exposed to nicotine are much more likely to use other substances. Okay, next slide. This is a slide I like to share I share it in a different way with teens, but I want teachers and administrators and schools to be aware of NICSIC. This is symptoms of nicotine poisoning from vaping. This is when somebody gets too much nicotine, because it is a poison, it is a neurotoxin, and they could get really sick. I have heard from school nurses over the years, they would see this and kids would be too afraid to tell them that they were vaping, and they wouldn't get the medical attention they needed. And they're afraid of getting in trouble. Next slide, and then I'll tie the two together. So the other issue that schools might see and teachers might see is signs of nicotine dependence when somebody is experiencing nicotine withdrawal, which is what happens when you don't have enough nicotine in your system just to feel normal again, which is how I describe it to kids. And you need to keep putting it back in your body again and again just to feel normal. And so these are some of the symptoms of what that can look like. And it also, to be fair, it looks like something that could be, most teenagers deal with these kind of symptoms just by the fact that they're in adolescence. And this can happen for them just because they're dealing with adolescence and are dealing with mental health issues, but which is also connected. But what I just want to say to you as administrators and school policymakers is that we want you to be aware of these symptoms, both of NICSIC and nicotine withdrawal. we want to encourage the implementation of a school policy that would ensure students won't face disciplinary action if they seek help from a trusted adult at school when experiencing these type of conditions. And they would be made aware that we're just going to get you the help that you need, and to have something set up for that. And I know Marissa's going to go much more into detail about school policy, but it's something that is a conversation I often have with schools about how to reach kids who are too afraid to tell you that, or don't have a trusted adult at home to talk to, and are too afraid that they're experiencing these kinds of symptoms to get the help that they need. Okay, so next slide. What is in this stuff? Okay. You know, we don't know as much as we know about cigarettes, and we know that regular tobacco cigarettes contain more than 7,000 chemicals, many of which are toxic. We know so far that there are 67 known chemicals. Many of them are cancer causing. I say it's in the vape aerosol, not just in the e-liquid, because what happens, you end up with heavy metals that you're inhaling, because trace amounts of the heavy metals, because the devices are made out of metal, leach into the e-liquid aerosol, and people breathe in heavy metals. And we also know that there are cancer causing chemicals, like I said, like formaldehyde. We also know that there are thousands of unknown chemicals. This was a 2021 study that looked at the vape aerosol, and they saw thousands of unknown chemicals that they didn't even have a name for yet. And that is what's going in directly into the lungs of people who are vaping. Okay, next slide. I'm going to just leave you with this slide. When we talk to kids about this, we want to also explain that, you know what, something that you can put in your body, like cotton candy, which is made out of ethyl maltol, which is a chemical sweetener, can change chemically when it's inhaled. That some chemicals, like propylene glycol, which is the #1 ingredient in vapes, turns into formaldehyde gas when it's heated. And in this situation, I use cotton candy as an illustration for teens, that what happens is if you're vaping in this ethyl maltol, which is obviously safe to eat in the cotton candy if you're going to eat cotton candy, but when you inhale it with the heavy metal copper, which is again leached into the aerosol, that can kill lung cells. So it's not just about the nicotine, it's about so many of the different interacting chemicals that are in the products. I will leave you there, and this can damage your lungs, as you see on the slide, and I'm going to turn it over to Pat.
Thanks, Elise. Lots like this is a crash course for accelerated.
I know.
Yeah. Yep. It's good. So yeah, I always tell kids too, Jello is approved to eat, but you don't want to inhale it. Next slide. I'm going to give you some of the data. And I think I'm going to go quick through the data because it has changed so much. And along with the product change, we had a pandemic in all of this. And the mental health condition of students is directly related to this self-medicating doing with vaping and that increase of it. So just showing you these data over the, anytime you have a young person or an adult that tells you, when did you first use a cigarette? The younger they tell you they used it, the more likely they are to really struggle with getting off of the drug and face a lifetime of addiction. I say the youngest person I've ever worked with said I had the cigarette behind the barn when they were like 4, and the oldest was 63. Well, the 63-year-old had a much easier time quitting than that one who had had a lifetime. And that developing brain, those pathways to that dopamine release, that pleasure, that escape. And then what are the products, the first products being used? I think the good news here is cigarettes are kind of maintaining the uncoolness within young people. And the industry knew that because many of the leading vaping products have big tobacco behind them, and you're going to see that e-cigarette number go up. Next slide. And then this one is, right, nicotine dependence of NA. People often say, how do I know I'm addicted to smoking? How do I know I'm addicted to these things? And a key question is, how soon before getting up do you reach or have this device? And if it's less than 5 minutes, or some people tell you, I wake up at night, I sleep with it, I get up to smoke, I have my vape device by my bedside, that's an indicator of addiction. And you can see how quickly that has taken hold with these devices. As Elise said, that combination of salt-based was the key chemical combination to getting the nicotine hit from a vaping device that almost exactly mirrored inhaling off of a cigarette. That was the magic of Juul. Black magic, I'll say. Next slide, please. So this data came out just a week ago. The good news is that across the country, the amount of high school students using these devices has gone down. I think Elise's experience in the classrooms with kids saying they know their brain hasn't developed. But I think the startling news is the middle school. And if you're not talking to your middle school folks, this is where it's at. And I'm sad to say I've had schools request curriculum for third graders on this issue, because again, this stuff tastes like candy. It tastes like fruit. And when you had to inhale on a cigarette, for any of you that learned to smoke, there was a learning curve. You just didn't pick that thing up and inhale and say, wow, this is great, let's do this. It took some work for your lungs to tolerate that. And then, of course, we want to, say, what are they using? Elise has done a good job of sharing that. It's going to change. And then, of course, it's all about the flavors. Next slide. So again, who's using flavors? It's like everyone, and menthol is one of those top ones. I'm gonna talk about flavors, and because that's an important piece to what I look at as an advocacy person, not just how do we continue to keep chasing kids and wondering what we're going to do with them, how we're going to handle them, is how are we going to go upstream and fix that dam that's broken and make a big difference in this epidemic. Next slide. Yeah, this one this is my fault. I didn't get all the data in here, but I want to say to this one that the increments here are very small. I don't want to minimize that there is more prevalence among the Native Americans, but I will say with these devices, it also crosses all economics. It's school council kids, it's athletes, it's like those kids that you would think, oh yeah, them again. It's all across those, and that is very different than smoking. And our assumptions or our biases about who's doing this, just anybody's kid is doing this. Early on, I remember how many physicians I was working with would tell me afterwards, I found out my kid is vaping. So next slide. And how did you get how did you get it? Now, a lot of folks argue that it's the internet, but I would tell you right off, look at the real numbers. It's only 4%. I don't want to say only as being not enough, but it's really about getting them from friends. I know that it, right before the pandemic, the age to purchase any tobacco product raised to 21, but kids are getting these devices. They're sharing devices. I know I've witnessed at many events that pass around of the device and everyone taking a hit off of it. So, we asked them and this is what they told us. Next slide. And I do want to, I pointed this out because I think a lot of times when we think about issues and what's going on, we think the big cities lead, but on this issue, it's Greater Minnesota who is using these devices at a higher rate and significantly higher rate than the metro area. So just that's a heads up that we don't like, oh yeah, the big city kids are doing that. It's everywhere in our state and our country. Next slide. All right. So I remember the wise words of a former commissioner of health who was the medical director at the University of Minnesota. And at the time, my young daughter was going to leave for college. And he said, we can always predict who the binge drinkers are, because if they are it's the smokers. At that time, this was a few years ago. And smoking is directly related, and I'm going to say nicotine now, addiction is directly related to other drugs. And that's some of my real concern about this. It's not a single drug use. You see students that use the nicotine and then they combine it because it opens a pathway in the brain that actually makes that next drug even more enjoyable, more pleasurable. And I think you can think about it as when we were working on smoke-free air in our state and in our country, people would say, "Oh, I only smoke when I go to a bar, when I have a drink," because they go together. And I say, yeah, like salt and pepper, they go together. So that is it. Also, a really big concern about this, especially, we're all acutely aware that we've legalized recreational marijuana. It's not. That is also a piece of this puzzle of what kids are vaping and how they're going to choose to get these drugs. All right, next. Vaping and mental health. I am passing that one on, I believe. Am I wrong? Sorry, got carried away with that.
No, that's you.
Nope, it's still me. All right,
It's still
sorry.
you.
Sorry, it's Friday. It's Friday. Yeah, sorry. My mental lapse there. Well, this is a really important one because we know kids are using, but this is about the why and what it's related to. And it really is about self-medicating. It is really about depression and anxiety. And I think in part of the plan what schools look at for youth that they are catching with these devices and catching again, that really looking at what's going on and why they're doing this is an important piece of assessing kind of next steps in working with them and providing them services based on a public health perspective and not a criminal perspective. They're violating the law. Next.
Okay. Oh,
Okay. So vaping prevalence by students that report having a long-term mental health problem in grades, and you'll see, I mean, it's just like kind of one of those they're struggling with depression and anxiety, and they're vaping to try to get some of that relief, that brain relief, the dopamine to feel better, self-medicating. Next slide. And again, this one actually was a slide that really from the 2019 survey, and I have to think it's only increased. Remember, this data is from 2018, but it's put together in 2019, and that's pre-pandemic. But these numbers should be sobering. They should be a flag. I used to say a yellow flag, but I think it's a red flag now, of students who have used tobacco in the last 30 days. And at this time, it was mostly vaping also. Um, how many reported that they had depression, anxiety, and beyond that had ever considered suicide, and whoever attempted suicide? Next slide. And the same in a different way. It's put a different way. Sorry, these are duplicates. Oh no, these are the developmental assets. Those that go back, those are students that had assets and, that kind of resiliency factors that we can measure. And again, when you think about how are we going to address this, what's missing here, what skills are missing that we can help build so that we change this behavior as a way of coping with that stress, anxiety, depression, and suicide ideation. All right, next slide. And, so the summary, 90% of those who quit vaping say they are less stressed. It's kind of that, get what you think about people that smoke, adults that may be smoking combustible cigarettes. Oh, they do it to relieve stress. Well, they relieve stress because they're in withdrawal. And in reality, when we measure it after they've gone through the withdrawal and recovery, they do feel less stressed, anxious, and depressed. They also report that they feel more in control. Students are already telling us they feel out of control because we've never seen nicotine addiction at this level in our students in our country. We didn't have kids that were smoking a pack a day. Nonetheless, from what Elise showed you, up to 2-3 packs a day worth of nicotine in their bodies. And then again, they want to quit. I do think we all want to, but we have to show them that there's ways. I don't even like to say quit to them. I like to say treatment. Let's talk about treatment for this addiction. All right, next slide. And how did we get here? All right, Elise, how the heck did this happen?
right. So I think this is really important for adults to understand along with some of the things that Pat just said about, how can educators and parents help build resiliency skills for kids, and how does that happen? So along with that, and understanding that those issues is, how did this happen to a generation who would never pick up a cigarette, most kids? Who did this? So one thing that I find fascinating is the tobacco industry has been doing this for a very, very, very long time. As you can see, and these are some slides I share with high schoolers when we talk about this. These are from tobacco industry memos from the late 70s. The base of our business is the high school student. When we talk about this with kids, why do you think that is? Because we also talk about how, 50%, half the people who smoke, who use the product as directed, will die. So why does the tobacco industry say the base of our business is the high school student? Of course, because they have to replace their consumers who die. So I just kind of want to get kids riled up to see that they are being targeted. And something else I have to be careful about when we talk about this, but because it's egregious, is something that we all have seen in the tobacco prevention world over and over. What an RJ Reynolds executive said about why he didn't smoke. And that just sinks into kids. And I think that that's something really important for kids to see, that that they have been targeted for more than 50 years. The tobacco industry is always looking for cheap prices, appealing flavors, and targeted advertising to attract them. And something just to think about too, the tobacco industry spends billions of each year to market and advertise their products. And in Minnesota alone, the industry spends more than $100 million a year. And that $100 million doesn't even include the marketing around vapes. That's just the cigarettes and other tobacco products. And so it's even higher than that. I also want to point out there's a huge commercial tobacco lobbying presence. In fact, in 2021, tobacco companies registered 236 lobbyists at the federal level, and more than 1,000 lobbyists registered at the state level. That's an unbelievably large amount of influence we are up against with our work to enact strong public health regulations and policies. Next slide, please. And it started with Juul. And as you saw the data that Pat showed, you could see when 2015 and 16, 17, how youth vaping went up. There's just some images for you to look at. The Juul launch party in 2015, they spent more than $1 million to market for its launch. Okay. And, it's design. Look at the design. Young, cool, hip kids looking fabulous, and you want to be them, and they're vaping, and they did it all under the radar. I remember talking to teachers and administrators in 2017. They had no idea what was going on social media. To be honest, I learned the most from my own teenagers at the time, my own children, about what they were seeing on social media and what I should be looking for in public health, because the adults didn't see it. Juul advertised in ways that adults were not thinking that to look at. Like they weren't in radio and print channels where adults were most likely to see them. They focused on kid-friendly social media, and they even focused on Cartoon Network. If you look at some of the documents that have come out of the Juul lawsuits, according to many of the lawsuits by the states that have been suing Juul paid a company to place digital promotions across websites, including educational sites like basicmathematics.com, coolmath.com, social studies for kids, high school sites geared towards almost college age kids looking at, high school kids looking at College Confidential, all those little pop-up ads, and even sites geared to much younger kids like hellokids.com. So this is going on 2016, 2017, 2018, but by late 2018, Juul tried to distance itself from its vast social media presence, and it took down its Instagram and Facebook. And as we all know, though, kids aren't on Facebook anymore. But in November 2018, it stopped paying celebrity and social media influencers, and they had been paying a lot of money to get people to show that they were using these products. So why am I giving you all of that? Because I want you to know how Jules set the stage for this. And I get so angry. I feel like, because kids have been targeted with these products, and so many have become addicted, and it's not their fault. It's what's been thrown at them. So I want to go to the next slide, because I want you to see, I'm just going to give you some brief points in the Instagram, social media, TikTok world over time. So this was early 2020. This is right before COVID. Some posts from kids. The one on the right is actually from one of our students who sent it to us. One of the students I've worked with in tobacco prevention. Somebody, an 8th grader, that she saw, if I get a box of Puff Bars, that was the #1 brand a few years ago. I think it's been eclipsed by, what is it, Esco? Who wants one for $25? An 8th grader, So that's what we were seeing back in 2020. And, my Puff Bars in my sleeve, my teacher's behind me. Okay, so next slide. So this was all over social media. Let me just fast forward to 2020 to TikTok, where that's the place that I've seen this the most. And I think kids are seeing, talking to kids as young as 7th and 8th grade, they're on TikTok. So as you can see, these are kids posting on TikTok. And I just want to point out the one about, I'm from Minnesota, where you either have a Loon Max, you have merch, highlights, or all three. There are hundreds of posts like this on TikTok. Okay, I would like to go to the next slide. I wanted to show you a little bit about the hashtags around all of this, just to show you give you an understanding about how ubiquitous this really is. The one on the left is Elf Bar. That has over 100 billion views here. Over 1 billion views, not 100 billion. Elf Bar is now the #1 product used by teens, according to the 2023 national data Pat showed. Yeah, it's you can see that there's just tons and tons of traction around this and what kids are saying. And there's plenty of posts like the one you see on the right that's just about just using different terms, just like the word vape, vape tricks, vape challenge. So much out there. There's a huge rabbit hole you could be going down. Just one little side note in case you see, that's okay, you can go on forward. One side note about the Elf Bar, they just recently changed their name due to a copyright issue to EB Design. So you might see that, and that's the same thing as Elf Bar, which is, again, this very, very popular product with teens. Okay, this is where I want to leave you. What I want to leave you with, this is something I recently learned about. I don't know if you've seen this as educators. There are a number of posts on TikTok with kids doing dances, with dancing with their vape guns that they've made, turning their disposable vapes into guns, and posting challenges on TikTok. And then on YouTube, they will describe how you can make that. So I just want to leave you with that. There's so much more out there that kids are being exposed to, and it's really impacting them. And when there's, as Pat said, like with the mental health piece of this, I mean, that is all tied together with with social media and mental health and all of this. So I leave you with that. Great.
Thanks, Elise. Thanks, Elise. It almost makes you like, okay. So what can we do? And I'm going to make a pitch as my work with the Smoke-Free Generation. Next slide. Coalition. I mean, we are the coalition of over 63 agencies who come together to really look at the big picture of reducing the epidemic, not of, of all commercial tobacco products. And so what can you do? It says, what can your school do? But what can you do and your schools do? So we really, I'm about policy. Again, I say we can chase kids, catch kids, try to do things on a one-on-one, but the bigger impact for change really is about policy and how companies do their business. And I would say, I do believe in individual responsibility, and I believe in community responsibility and corporate responsibility. And this is talking about responsibility around how these are both for the community and corporates. So our key effort during the legislative session is going to be about ending the sale of all flavored commercial tobacco products, including vape products. And it's a really important initiative. We know that 5 other states have done this. We know that it makes a difference. We know that kids love the flavors, and tobacco doesn't taste that great. Tobacco taste. So that is our highlight. So next slide, and this is how you can get involved. It's, adding it to your legislative agenda. Also we're doing a day at the Capitol. If you've got classes that may be going to the Capitol as part of civics, etc., that this is really a top issue on kids' minds. And we haven't even said much about the environmental impact. And then talking to your decision makers, both locally. These are issues at the city level, they're issues at the county level, and they're issues at the state level. They need to hear from across our state that this is everywhere and it is out of control. And we need, like 3 principals said in a community I was working with that did do a restrictive policy saying, we've done our part, we need your help. All right, now on to Public Health Law Center.
Great, thank you so much, Pat. Let's go ahead and go to the next slide. I'm an attorney, so I have to give the standard disclaimer. The Public Health Law Center is a nonprofit organization housed at Mitchell-Hamlin School of Law in St. Paul. We're comprised of attorneys, policy analysts, and support staff who all work to address public health in various areas, including commercial tobacco control. We provide free legal technical assistance to communities, public health advocates, and other partners in Minnesota and nationwide. We also publish on important issues, and we offer trainings and webinars. We do not provide direct client representation, nor legal advice, and nor do we lobby elected officials. Next slide, please. So before I dive into any K-12 policy provisions, I want to first acknowledge what you as school administrators are experiencing on the ground every day. And these are some of the most challenging times, as Elise and Pat did a great job informing us all on, that when it comes to smoking and really vaping in schools. And we did make real progress with plummeting rates of combustible cigarette use, but now, of course, we're seeing this unprecedented epidemic in youth vaping. And this was already alluded to in a previous slide, but just last week on November 3rd, we had the National Youth Tobacco Survey released. And while there was a bit of good news with fewer high school students vaping this year, 10% said they had used e-cigarettes in the previous month, which is down from 14% last year. The rate of e-cigarette use among middle schoolers, however, stayed roughly the same at about 5%, but the numbers are still really high. And 1 in 10 middle and high school students said they recently used a tobacco product, which translates to 2.8 million kids nationwide, nearly 90% who use vape products. And of those, the 90% are flavored with candy and fruit flavors topping the list. So schools are truly on the front lines in battling this epidemic, which is really unfair because schools are cash strapped as it is. And when you have such high numbers of students vaping and who are very addicted to these products, it's not realistic to expect school districts alone to bear this burden. But here we are. So what can schools do? They can review and keep updated a current commercial tobacco-free and smoke-free policy, along with a prevention curriculum, which these are both tools school districts can use to curb use of tobacco products. And of course, I'll be talking about the policy today. There's also parent education, which is a critical component in making sure families understand the smoke-free, tobacco-free policy that's in place in their child's school. Relatedly, the promotion of health messaging and offering cessation support for students who are struggling with addiction. And then, of course, there's litigation. And this one, as we know, is not easy or cheap, but it is a tool nonetheless in combating the vaping epidemic and was most recently utilized in the multi-district litigation, which included school district lawsuits against the Juul. Next slide, please. So looking at comprehensive school policies and the enforcement mechanisms for schools to ensure compliance with those policies, Public Health Law Center has 3 Minnesota-based publications that address these policies in schools and how to enforce those policies. One is formatted as a Q&A resource that explains the rationale and the evidence behind specific components of our model policy. The middle one is our model policy itself. And the third resource focuses on the use of alternative measures in school smoke-free policies. It provides sample language and evidence-based information on why alternative measures to suspension and expulsion are more effective when addressing student violations and youth nicotine addiction. Next slide, please. So when you review our policy, you'll see it's truly comprehensive and includes provisions that go well beyond simply prohibiting smoking or vaping on school grounds. For instance, comprehensive definitions are a cornerstone to our model policy. So they'll cover nicotine and non-nicotine containing substances. The policy also prohibits commercial tobacco products on campus, as well as school-sponsored off-campus events. It addresses as well involvement of the tobacco industry in schools by prohibiting donations, curricula, or other means of promoting the industry or their products. And most importantly, enforcement is focused on effective strategies to address student infractions that focus on support and help with addiction rather than suspension or expulsion. Next slide, please. And we provide a comprehensive framework in our model policies, so all legal bases are covered. In the interest of time, I'm not going into depth in each of these, but I will highlight a few of the substantive policy areas. And we do frequently get the question, do we really need to do all of this? Can't we have fewer provisions or more streamlined policy? And our answer is always, if you want a strong policy that communicates all elements clearly and without ambiguity, it's important to have all of these elements. There are really no cutting corners if you want a strong, comprehensive policy. Next slide, please. The purpose section of the policy depicts the school district's goal of a safe and healthy learning environment. And the purpose section also makes clear the beliefs and values of the school district. It provides the reasoning and rationale for the policy's elements. And the policy also includes findings, which also play a role in creating the rationale for the policy's elements. Next slide, please. Comprehensive definition section is absolutely critical. It defines the key terms used throughout the policy. These terms are really important because they ensure coverage, clarity, they support compliance, while also eliminating any ambiguities or loopholes in the policy. So for example, the definition of smoking is going to include not just nicotine and tobacco, but also marijuana or other plant that is used for inhalation. The definitions also clearly spell out the who, what, where, and when of the terms used throughout the policy. So for instance, at all times means 24 hours a day, 7 days a week. Next slide, please. One important distinction, the policy provisions are a little bit different for students versus staff, administrators, and visitors. All are, of course, are going to be prohibited from using, consuming, displaying, promoting, or selling these products. But in our policy, students are also prohibited from possessing these products. In theory, you could prohibit staff, administrators, and visitors from possessing, but that's going to be very hard to enforce, and it's not really a good use of limited school resources to monitor those individuals. Next slide, please. So other important key components of the policy, they prohibit schools and districts from accepting industry sponsorships, donations, money, or curricula, as well as prohibiting anyone from promoting the products. And that would include signs or gear like backpacks, cell phone covers, clothing, apparel. And you can see why prohibiting industry sponsorship is so critical. The image on the right is of a book cover produced and distributed by Philip Morris, which you can see is clearly uses subliminal or not so subliminal imagery with the bottom of that snowboard resembling a lighted match. And the tobacco industry, of course, has long been doing this for decades and continues to try to get into schools. And sadly, they continue to have success because schools are strapped for resources and they will be inclined to accept any source of funding regardless of who or where it's coming from. Next slide, please. So before I dive into enforcement, I want to just briefly highlight the policy's 3 exceptions. The first is for the sacred and ceremonial practices by Indigenous people. And second is if tobacco products are used as part of formal instruction and are not smoked, chewed, or ingested in any way. And the third exception to the policy allows cessation or nicotine replacement therapy for non-students who are over the age of 18. Next slide, please. And next slide. So the key takeaway from our enforcement section is that there is no suspension or expulsion for infractions found anywhere in our policy. Instead, we've outlined a set of escalating consequences for student infractions that are aimed at supporting youth in quitting these addictive products and resisting the peer pressure to continue the use of these products. So why steer clear of punitive measures like suspension or expulsion? What is the rationale behind this? Next slide, please. Suspension and expulsion arising out of student violations of a school's smoke-free policy is ultimately not reasonable or fair for students. And Elise and Pat had alluded to this earlier, which is it's not fair because we're factoring in the targeted marketing of youth by the industry. We're also talking about the science of addiction and nicotine on the adolescent brain. And we're also talking about the long-term consequences associated with suspension and expulsion, especially with the proven disparate use of these punishments with certain racial, ethnic, and socioeconomic backgrounds. So the evidence has shown that punitive penalties do not work, and they do not help youth overcome their addiction to nicotine. They also result in inconsistent and unintended consequences, such as disparities in enforcement as well. And they also, can you go back just for a moment? They also serve to blame the victim. So punitive measures really do discount the fact that the tobacco industry has deliberately targeted this population in a very calculated and very predatory manner. We saw this play out in the Juul litigation. And we also know the industry has historically and continues to target young women, Black, Indigenous, LGBTQ communities in particular, with the marketing of these tobacco products. And they've done so for decades. So assessing punitive measures against students for violating smoke-free policies can and often does result in the unequal treatment of students based on race, gender, sexual orientation. And this is the case even if there is no implicit or explicit bias informing the decision-making process. Next slide, please. So in addition to factoring in the industry targeting of youth, we also have to consider the role suspension plays in student disengagement. Out-of-school suspensions are, of course, effective in removing the student and the problem from the school, but at what cost? Suspension leads to isolation, and without parental or other supervision, the isolation may in turn lead to greater use of these products that the student is addicted to. And we all know missed school exacerbates the problem of students being disengaged from school. By way of example, this graph is of 8th grade reading and math NAEP scores, which simply illustrates how school performance is negatively impacted when students are out of school. So by suspending students for vaping, we're contributing to a downward cycle of poorer school performance, which in turn causes less engagement in school, increases isolation, as well as the continued use of these products. Next slide. So the alternative measures contained in our model, as I mentioned earlier, the policy sets forth a series of escalating consequences, but for each infraction, it's required under the policy that the products be confiscated and that parents or guardians are notified. There are also additional options for student chemical health assessments, tobacco education programs, cessation and counseling services, and educational community service. Next slide, please. Whenever possible, the penalties should focus on education and counseling, not suspension, as I've said, and certainly not any police involvement. Engaging law enforcement and the criminal justice system will open the door to selective enforcement against youth by certain racial, ethnic, and socioeconomic groups. Evidence suggests these youth are disproportionately overrepresented in status level offenses, which increases their interactions with law enforcement and the greater likelihood of introduction into the criminal justice system. Remember, at the end of the day, this is a public health policy, right? So the public health aim is to prevent and treat addiction and avoid exposure to secondhand smoke. This is not a policy that's used as a tool to invoke penalties, and certainly not criminal penalties. Next slide, please. The emphasis in our policy on addiction support and access to cessation is also really important, not just for students, of course, but for also administrators and staff and even visitors. Each state provides free quit line services, and many states and local communities provide cessation assistance that's specifically for youth, including here in Minnesota. So it's important that the policy refer to these resources available locally so that they can be widely disseminated school-wide. Next slide, please. I want to briefly mention the issue of tobacco product waste. It's an issue, which includes the confiscation of tobacco products and how to safely handle these toxic and very hazardous products. Tobacco product waste, of course, remains an urgent problem for schools given the environmental hazards that these products contain, including e-cigarette waste. The Public Health Law Center does have resources on this topic, which includes both a recorded webinar as well as an FAQ publication for schools as they grapple with how to dispose of confiscated tobacco waste products. Next slide, please. I want to just quickly highlight there were over 1,000 school districts across the country, including a handful in Minnesota that were part of the multi-district litigation settlements against Juul. There isn't a whole lot of information out there detailing what's in these settlements, but school districts have publicized how much money they're getting as well as how they're going to spend those funds. Some intend to use the funds to hire staff to develop anti-vaping curricula, as well as implement prevention and cessation programs, which is fantastic. But we've also heard that a lot of districts have indicated plans to invest in vape detector devices on school grounds. And I want to flag this last one because the effectiveness of vape detection devices remains uncertain. And given how expensive they are, probably not the best use or investment of funds. It's not clear they work all that well. Vape smoke, as we know, quickly dissipates, but importantly, their use can also create a culture of surveillance, which then leads to punitive disciplinary action against students who, again, are just struggling with addiction. Next slide, please.
Marissa, this is Deb Henton. I'm really sorry to cut you off, but our time is up.
Okay.
In fact, we're just a minute over time, and it was just a really informative presentation, and we are so grateful. Dave will get a recording out soon, and we have put your contact information up there for our participants who've already let me know that they really appreciate this session. So Pat, Marissa, Emily, Elise, do you have any final closing comments? And again, we are have gone a little bit over our time, so if you could wrap up this session, that would be great.
I don't have anything. Thank you.
Oh, thank you. And I'm so sorry to have cut you off, Marissa. We just are really try to,
That was my last slide.
yeah, okay. My apologies. You want us to go back to it?
No, that's fine.
And I'll just add the contact information is here. Please, please, please reach out. We are happy to talk with any and all of you about any of these topics. And any one of us can connect you with the others on this call.
There is one question in the chat that I don't know if you saw or not from Christine. Or comment, she said no LE involvement, even if it is a weed vape used at school. There's a question mark there.
Yeah, that's correct. And obviously THC vapes and marijuana are a huge problem. I would just say that there's also evidence about the use of marijuana products on the developing brain that cause addiction. So the whole discussion about helping students with treatment and overcoming their addiction to nicotine applies as well in the context of marijuana. So, it's unlawful for students to have tobacco under age 21. It's unlawful for students to have marijuana as well under 21. So from a school policy context, it's going to have this, that doesn't change the outcome of our policy or what we consider to be a best practice.
So again, thank you. And I see from your generosity that the PowerPoint can be shared. And I just want to say that we have a spring conference in March. And should you want to be presenters at our spring conference at a breakout session, please don't hesitate to answer our call for proposals, because you have obviously a really timely topic, a topic we all care about. And the more people we can reach with your message, the better. So thanks to all of you, and have a happy Thanksgiving.